Perfect. So good afternoon, everybody, and thank you for joining us this afternoon. My name's Heidi Buckingham, and I'm a sales and distribution consultant here at Zurich. Our webinar this afternoon is on psychologically safe and healthy workplaces, and our presenters are Dave Hounsell from Zurich's Resilience Solutions and Jason Balls from our claims team. I believe this is our last webinar of this year, so thank you for joining, and hopefully you've joined several webinars throughout the course of 2022. Just a couple of bits of housekeeping before we kick off. So everybody is in listen only mode. If you have any questions you'd like to ask, please feel free to pop them in the chat box and we'll answer them at the end. As I just mentioned, the session is being recorded, and I'll send around a copy of the recording and the slides that we used afterwards, as well as a feedback survey, which would be really grateful if you could fill in, especially the question about topics you'd like us to cover webinars on in the future. So with that, I will hand over to Dave to kick off this afternoon session.
Perfect. Thanks ever so much, Heidi. Welcome everybody to today's session on psychologically safe and healthy workplaces. In this webinar, we'll outline why psychologically safe workplaces should be of significant interest to employers, brokers, and insurers. We'll consider the threats and opportunities that effective risk management can bring, along with some of the indicators of risk exposure, claims, worker data, and specific sectors, for example. We'll provide some insight into good practice for risk management and the 3 levels of intervention that an organisation should have in place, and including how all of this fits into an ESG framework. And we'll finish with how Zurich can support our partners and customers in this area. So the topics we're going to look at is: what do we mean by psychologically safe and healthy workplaces? Why organisations should be interested, why insurers and brokers should be interested. We'll look at some of the questions, indicators and exposures that can start the conversation. We'll have a quick run through psychosocial risk management principles and controls. We'll have a look at what the future might hold in this area. And finally, how insurers and brokers can help. So as we take you through this, we'll mention some of the latest data, a little bit on the legal landscape, and some hints and tips on risk management that I hope will encourage you to take action. But first, let's take a look at what we mean by psychologically safe and healthy workplaces. So the first blue box there, psychologically safe. Just have a read of that while I'm going through this. So I could have picked any number of titles for this presentation. We could have gone for stress management, mental health, well-being, mental well-being, worker resilience, or any number of combinations of these. I picked psychologically safe and healthy workplaces, not because the others are wrong or irrelevant, but because it's the best fit for how we can support our customers. By that I mean to support our customers to produce strategy, policy and practice that enables individuals to thrive, flourish and grow, to protect their workforce from harm, and where necessary, to restore people to health. I think it's interesting that the WHO, the World Health Organization quote on the slide, promotes the idea of enabling positive mental health as opposed to simply preventing poor mental ill health. Too often the conversation tends to drift to the negative. So please note that the definition for psychologically safe references the new ISO standard 45003. The WHO guidance, and both of these documents have been published in the last 2 years. Australia has been the latest country to legislate on the requirement for employers to assess and manage psychosocial risk. Trade unions in the EU have campaigned for similar legislation for EU members, and in July the European Parliament asked for a directive on psychosocial risks to be proposed by the European Commission, and in doing so it's for the 2nd time this year. All of which is a bit worrying for the UK. It leaves us potentially languishing behind other developed countries in this regard. This is despite our economy relying so much on sectors and organisations that have above average reports of stress-related absence. That is larger businesses, health, social care, education, professional and technical occupations, and the customer service occupations. More data and analysis about this is available in the HSE's, the Health and Safety Executive's latest report, which was released yesterday. So the World Health Organization recommend a holistic approach to health, one that considers the whole of the workplace, the diversity of that workforce, input from different subject matter experts, and one that understands how a healthy workforce supports organizational objectives. And the final box there, workplaces. The world of work and workplaces themselves is changing. Just at the moment, I'm working from home. Jason is at a hotel and Heidi's in our offices. So we are the very embodiment of this. In 2020, CIPD, the Chartered Institute of Personnel Development, reported on a survey of employees that revealed that 32% reported a change in their use of technology in the past year. 29% said that mobile devices blur the line between home and work life, and 73% felt that workplace monitoring would damage trust between employers and workers. Very interesting statistic in the latest HSE report is that levels of stress-related absence are now higher than pre-COVID. This is despite so many of us having more flexible working arrangements that are supposed to reduce some of these risks. So there's clearly many other factors at work that may impact people's psychology and mental health. Our focus today is what employers can do to control psychosocial risks associated with their work and what they might do to support workers to cope with the normal stresses of life. So let's have a look at the business case for organisations. Why a psychologically safe and healthy workplace is important to all organisations. The two main reasons are that it supports the business to grow and that it helps to manage costs. Two sides of the same coin. There's lots of different models of mental health and well-being that describe the factors and conditions that an individual needs. However, all of the models have four main aspects as shown on the slide there. The financial side of things, that people are able to afford the basic necessities of life and the income is secure and stable. Physical, that people enjoy sufficiently good physiological health and adopt behaviours that support this. Mental, as we've already seen, this means people are sufficiently psychologically resilient to deal with day-to-day stresses and to make a positive contribution to their work and to society. And then there's the social side. And people understand their role in the organisation and benefit from respectful, positive relationships with colleagues, especially their line managers. So this presentation is really about how an organisation can manage the psychosocial risks from its work and develop a workplace that enables individuals to realise these four aspects of safety and good mental health. Returning to the two main reasons, a workforce that is both healthy and satisfied helps the organisation to flourish, to be productive, to innovate, to recruit and retain talent. And secondly, by managing staff turnover, sickness absence, and the associated compensation, an organisation can control the costs associated with poor mental health. Recently, I visited one of our large customers who had a project in place around ways of working, together with workplace design. The main aim of this was to make them a more attractive employment proposition, to have satisfied, motivated employees. Better mental health was one of the intended outcomes, but it wasn't the key driver for this project. In 2019, the LSE Centre for Economic Performance found a significant, strong, positive correlation between employee satisfaction with their company and employee productivity and customer loyalty. A strong negative correlation was also shown with staff turnover. The authors stated that ultimately high well-being at work is positively correlated with more business unit level profitability. They further found that in the financial sector, well-being and productivity were strongly related, possibly due to better work-life balance. In manufacturing, the correlation was strongest between employee satisfaction and profitability, possibly due to a focus on efficiency and safety that reduces costs. And as early as 2014, the Department for Business Innovation and Skills found a high sense of well-being amongst a few workers is insufficient to cancel out a low sense of well-being amongst everybody else. So it's important to have an inclusive and accessible approach to psychosocial risk and mental well-being, as any who are excluded or already suffering or experiencing lower well-being are less likely to engage with improvements. Communication strategy for mental health and well-being is critical. People need to be given the time to consider and prepare for change, even when it's something that's intended for their benefit. So what about managing the costs? In January 2020, Deloitte reported the overall cost of poor mental health to UK employers as 45 billion, up from 33 billion in 2017. I find these massive numbers a little bit hard to relate to sometimes, particularly in terms of, what are we going to do about it, or how do we use this data? So it may be more useful to consider data at an individual business level to help us work out what might be happening within our own organisations. So, for example, the Stevenson report stated that average costs for individual employee absence due to mental ill health from absence, presenteeism and turnover ranged from about £930 in hospitality sector to £2,500 in the financial sector. It's a little crude, but a company can multiply this up using data from their own employee numbers. And similarly, the HSE data shows the average duration for absence due to stress, depression and anxiety is 18.6 days. A reduction from 21.6 days a couple of years ago, but it's still more than twice as long as the average absence due to injury. This figure again can help an organisation to benchmark the severity of harm that they are experiencing, but also the effectiveness of any rehabilitation and return to work programmes they have in place. And 9% of employment tribunals cite stress as a contributory cause. The main claims since workplace changes since the pandemic have been unfair dismissal and working time. Claims on the basis of part-time work and age discrimination have gone up by 767% and 530% respectively. One thing that's curiously missing is any specific legal standard in the UK for the management of psychosocial risk and mental health, other than through related legislation such as the Management of Health and Safety at Work Regulations and the Equalities Act. I've already mentioned voluntary ISO standard 45003 and the WH guidance. It's worth noting that in 2022, the International Labour Organization amended the fundamental principles and rights of work to include the right to a safe and healthy working environment. And finally, just talk a little bit about sustainability. Something that is of increasing interest to organisations is their ESG performance. So Sustainable Development Goal 8 refers to decent work and economic growth. How can an organisation that is not managing psychosocial risks say they are providing decent work? And Goal 10, reducing inequalities. Effective psychosocial risk management must cover all employees equally and fairly, both in terms of the assessment of risk and the availability of risk reduction, resilience, and rehab programs. And despite all this, a survey by the European Occupational Safety and Health Agency found only 70% of organisations had a plan in place to prevent work-related stress. So we can turn this around and look at what this means and why it's important to risk management and insurance. Zurich Risk Engineering formed part of Zurich Resilient Solutions in 2021 with the purpose of providing our business partners and our customers with risk insights to help improve their own loss prevention and risk management techniques and strategies. We assist our customers to mitigate risks and minimise or eliminate losses. Risk management is in our DNA, and we can apply this experience to develop psychologically safe and healthy workplaces together with our partners and customers. So from a customer's perspective, the risk and insurance functions can use a similar approach to consider how the organisation prevents harm, how it sets and tracks improvement targets, and provides a view of itself to the insurance market. Increasingly, we're looking at the relationship between other losses, for example, physical injury, road traffic collisions, experiencing traumatic events, and even property loss and the mental health impact, a more holistic approach, if you like. Psychosocial risk and mental health are complex issues, both at an individual and an organisational level. Having well-considered improvements that help realise some of these benefits I mentioned on the last slide will go a long way. So later I'll run through how Zurich has aligned its proposition to the international standards for psychosocial risk management. Just a little bit on mental health claims. On the employee benefit side of the insurance business, particularly income protection, we know that mental health represents over 20% of income protection claims. We know that it represents 54% of return to work support. And the average cost of an IP claim is nearly 300,000. That's across all claims though. And that information is from the ABI. The highest number of liability stress claims are in the cost range of 50 to 100,000 pounds on reserve and commonly take around 2 years to settle. Most claims are defended and Zurich considers each on its merit. As such, they're very time consuming for all parties. But our mental health support with our claims proposition that Jason will talk about is very effective at 1, reducing absence, 2, successfully returning a person to work, and 3, reducing the likelihood of a claim. So key cases for stress liability are Walker versus Northumberland, 1995, Hatton versus Sutherland in 2002, which established the 16 Hatton principles that courts will look at, and Bailey versus Devon Partnership NHS Trust in 2014. And this signalled how the courts may develop the Hatton guidance for the more modern world, which we'll return to later. And bear in mind, obviously, that's 8 years old now. And the last thing I'll mention here is the importance of good record keeping, something that risk and insurance professionals should be well versed in, of course. Of particular note is the need for there to be a clear policy for reporting stress and mental health concerns that's been communicated to employees and followed. A suitable and sufficient method and records of psychosocial risk assessment and appropriate risk controls. Assessment and intervention for vulnerable persons, that is people who may be vulnerable by some condition or illness, or people who have reported vulnerability or feeling stressed at work for some of the categories that are covered in the risk assessment. There should be contemporaneous notes of meetings with individuals reporting symptoms and of actions that have been taken in response. And finally, keeping up to date with good practice for mental health and well-being. So how do we start the conversation? Either if you're a partner talking to your customers, or if you're thinking about your own organisation. I hope some of these will be relevant in either case. So the sort of questions you might ask yourself is really around what you might notice about mental health or stress in your workplace. So the sort of questions: what are your significant workforce challenges? Is it recruitment, retention, productivity, performance, etc., etc.? What's the aim of your strategy? Do you know why you're doing it? Is it to improve mental health and well-being, to improve business performance, a bit of both? And importantly, do your employees understand this aim? Who's leading your strategy? It should be a member of top management, but do they give a strategy a particular focus depending on their background, possibly to the exclusion of some of the other facets of this subject? How well is your strategy working? Can you measure the impact of the initiatives and interventions that you have in place? Which ones are giving you the best return on investment? How do you measure mental health and well-being, stress, or psychosocial risk? There's many potential ways, from using your existing knowledge, from worker surveys, risk assessment, job analysis, absence data, etc. Just as important are the conclusions you draw from this. Are people happy working for your company? Are you asking the right questions for your purpose and strategy? They may be happy with pay, but deeply dissatisfied with the culture, for example. And are you planning any big changes? One of the things that we know causes people stress and mental anguish. Do you have representative consultation and communications in place? If you're thinking about indicators and exposures, it might be, from the insurance world, it could be poor employers' liability, EL assessments, or even your own internal audits. If you don't measure mental health and well-being specifically, it's unlikely to be managed that well if the traditional occupational health and safety risks are not managed effectively. You may notice a deteriorating casualty claims experience. Similar to point A, really, that human factors are a significant factor in accident causation and may be an indicator of underlying psychosocial risk. Increasing use of employee assistance programs. There's lots of potential data touch points. EAP is just one. So what are people using it for, and with what results? You may have higher or increasing turnover of workers. People often vote with their feet. How well do you understand your employees' motivations and what is important to them? If we look more at the exposure side, we know from national data that work in healthcare, social care, and the education sectors is particularly prevalent for stress-related illness. We also know from the Office for National Statistics that it's not all public sector. About 40% of health and education professionals are employed in the private sector. Employers with high earners or performance-related pay. This is one, maybe a mix of risks intrinsic to the work, high demand and long hours, for example. But it does tend to elevate the costs of both absence and compensation. And G, very good audit or employer's liability assessment outcomes. I've added this one as a reminder that we should also be focusing on the positives and making improvements. So if you or your customer is doing the basics really well, maybe it's a good time to look at how you're managing psychosocial risk and mental health and how this can contribute to a positive risk culture. So if any of this strikes a chord with you, come and talk to us. Whether you need a check on strategy, policy, a method for assessing psychosocial risk, management training, or developing your rehab program, Zurich has something to offer you. We'll elaborate on this a little later. I'm briefly going to run through some of the aspects of psychosocial risk management, good practice, if you like, using the ISO 45003 standard, which provides guidance on the management of psychosocial risks and promoting well-being at work. This standard is a supplement to ISO 45001, which contains requirements and guidance on planning, implementing, reviewing, evaluating, and improving an occupational health and safety management system. Psychosocial hazards relate to how work is organised, social factors at work, and aspects of the work environment, equipment, and hazardous tasks. Hazards can be present in all organisations and sectors, from all kinds of work tasks and employment arrangements. They can occur in combination with one another, and they can be influenced and be an influence on other hazards. Psychosocial risk relates to the potential of these hazards to cause several types of outcomes on individual health, safety, and well-being, and on organisational performance and sustainability. So on the slide, I've included the ISO clause reference numbers in each of the little hexagons. So I'll very briefly just give you a little bit of a description of these things. Context is about the environment the organisation operates in, the standards it has to meet, external, internal issues that ultimately can impact on worker health and well-being, as well as organisational performance. It includes consideration of employee expectations. Leadership and worker participation is very similar to any other management system. The strategy needs to be led from the top and actively involve and engage all people who are affected by it. Clause 6 asks the organisation how it plans to assess psychosocial risk, how it plans to prevent harm, help people return to work, and maintain the management system, and to continually improve. It includes a standard for psychosocial hazard identification and potential risk controls, plus who and what to involve in the risk assessment process. Support mechanisms include competence, promotion, awareness, communication, documentation, and confidentiality. Think about classic claims defence issues here. Were they competent? How were they informed about the risks? Was performance and problems discussed? Is there documentation and records of all of this? Number 8 covers operations. The organisation should complete an assessment of risk, taking into account signs of exposure to psychosocial risk, the existing controls, and the management of change to determine whether the controls are adequate or need improvement, to identify if new controls are required, to eliminate work-related psychosocial hazards whenever possible, and control the risks if this is not possible, following the principle of the hierarchy of control. So fairly conventional safety risk management there. And it also introduces the idea, which I'll expand on in a little while, of using a combination of interventions at 3 levels. Primary interventions are organisational level controls to prevent or reduce harmful effects and promote well-being at work. Secondary level interventions are about increasing the resources that assist workers to deal with psychosocial risk by raising awareness and understanding through effective training and other appropriate measures. Tertiary level interventions reduce the harmful effects of exposure to hazards by implementing rehabilitation programs and taking other corrective and supportive actions. Number 9, performance evaluation. This wouldn't be a risk management presentation if I didn't say what gets measured gets done, or alternatively, you can't manage what you don't measure. People often take this as meaning objective or quantifiable data. This type of data does have its place here, but it would be a mistake not to also collect subjective experience, opinion, and ideas from the workforce. Performance measures should include active sources such as employee forums and surveys, as well as reactive sources such as sickness absence, claims, and hours worked, holiday taken, things like that. So based on what I've already said, hopefully you can see why we define the risk in the way that we do, and why ZRS chooses the ISO as the basis for how we evaluate and support our customers. It provides a familiar framework for any organisations that already adopt or register against 45,001, or are even familiar with 9001 or 14,001. If they don't, it's still recognisable as a plan, do, check, act management cycle. It focuses on aspects of psychosocial risk and mental health and well-being that are in the employer's area of control or influence. The way in which work is organised, e.g. demands, social factors, relationships, and the aspects of traditional risks associated with equipment, for example, ergonomics, tasks, dealing with challenging behaviour, and the workplace itself, e.g. noise. And just on the slide, you can see I've singled out clause 6.1 for particular reference. This is the one that relates to psychosocial hazard identification and what the organisation is required to do to meet the standard. Bear in mind the standard is not a legal requirement, but it is indicative of good practice. So I've picked on this one because it's one of the few aspects of risk management that the HSE can and do enforce, and that is the lack or the quality of psychosocial risk assessment. It's important to demonstrate what is required is no different to other risks. The approach can be the same. For an insurer, it's familiar from our risk assessment process. What are the hazards? How much of a risk are they? What is done to control them? And how can it be improved? As you know, risk assessment records are key to successful claims defence. In my experience, it's an area that many organisations are weak in with regard to psychosocial risk assessment. Particularly now we've got a much more defined standard for that within the ISO. And ZRS will soon be providing a digital psychosocial risk assessment platform that will form an important part of our proposition going into 2023. Other risk assessment methods are available, including the HSE Stress Management Tool, the Copenhagen Psychosocial Questionnaire, and What Works Wellbeing Question Bank. Some are free, but most, especially the better ones and those that provide management data analysis, do come at a cost. Personally, I think the investment is well worthwhile, and customers will soon see a return on their investment, particularly when you think back to what we've said about the costs and the benefits associated with mental health. So this slide just quickly is going to look at some of the psychosocial risk control. So hopefully now you're starting to see that what the ISO is doing and our approach is much more about prevention. It's putting psychosocial risk and mental health into, the good practice context that we expect to see for other health and safety issues these days. So we want to go beyond yoga and apples. So the requirement for risk control is similar to other safety concepts. In my experience, many organisations are doing this backwards. They fix people when they're broken, or worse, they let their condition drag on. And they encourage people to keep fit and eat well, yoga and apples, but they're not systematically looking for the cause of work-related psychosocial risk and addressing those issues. As Desmond Tutu once said, there comes a point where we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in. So risk assessment I described on the previous slide is the tool to identify those risk controls to apply primarily at the first level, the primary level that you can see on the slide here. I've singled out with bullet points the areas of risk that are most closely linked to psychosocial risk and mental health deterioration based on data from the HSE, What Works Wellbeing, the ONS, and academic research. There's many other potential risk factors, and it is important for every organisation to focus on the risks that are most pertinent and significant to their work and workforce. But these are the ones that tend to stand out across all workplaces. It's also important to remember that conventional workplace hazards such as noise, machine ergonomics, and even housekeeping can have an impact on people's behaviour and their mental health. The WHO guidelines were released earlier in 2022, a very interesting read. One of the actions that was both a strong recommendation for implementation and also a strong evidence base for its effectiveness is manager training for mental health. The guidance also makes the point that the emergency services tend to see a high rate of mental ill health issues, and these are singled out for particular improvement within the guidance. This is contrary to one of the traditional beliefs in stress-related liability claims that there are no jobs that pose an inherently greater risk. We'll come back to that. Coupled with this is raising worker awareness of the issues and that the idea it is okay to talk. HSE's Work in Minds programme is designed to support mainly SMEs with mental health management, including how to start these difficult conversations with colleagues. Workplace culture features heavily in this type of intervention. How are people treated? How do they treat one another? Is opportunity and access evenly distributed? Is there respect and civility? Effective rehab and return to work programs are essential to minimise absence, improve conditions for returning workers and prevent recurrence of the problems. Jason will talk more about this in just a sec, but I will just mention how important it is for effective records of this process, including interventions made prior to absence. Many stress claims have been defended on the basis of employer having no prior knowledge of an individual's mental health vulnerability or condition. Many claims have also been lost because of a poor audit trail or a failure to adapt the workplace following a first period of illness. The treatment and rehab should cover physical and psychological harm, and let's not forget the two can be interrelated. Physical pain takes a mental toll, and psychological ill health can manifest itself physically as well as affecting individuals' behaviour. So now for the next slide, I'll pass over to my colleague Jason, who's going to tell us a little bit more about the Zurich Casualty Claims Commitment.
Thanks, Dave, and good afternoon, everybody. As Dave said from the outset, I am in a hotel lobby, so hopefully it doesn't affect the quality of visuals and audio. So really just following on from where David left off. I mean, the purpose of for me joining this afternoon was really just to dovetail with Dave's sort of excellent sort of risk management prevention around workplace stress and mental health generally. So I was just going to really, give you an overview of what I'm seeing in the claims landscape. So I'm firstly should have said, I guess I'm the Claims Market Insights Manager here at Zurich. So a lot of my role is really bringing that horizon scanning insights back into the business to inform the business, but also to help support our customers and our brokers. So, so what are we seeing really across the landscape? So from a claims perspective, post-traumatic stress disorder has always been quite a common component head of claim following an injury. But I think certainly post-pandemic, and certainly with the increased remote working, we are seeing a sort of increasing trend across the UK with regards to workplace stress. And as Dave said, this comes in lots of different layers and complexities, but it's something that certainly I'm seeing a lot more of. We're not necessarily seeing an uptick in volumes here at Zurich, but it's something which is very much there across the piece. And again, the recent sort of economic crisis that we're in as well is obviously adding another layer of that stress. And if people are suffering in their personal life, that is understandable. That can sometimes come into the workplace. So as Dave said, it's really, really key that from our customers, brokers perspective, that we really have a best practice, sort of well-documented risk management around documentation, admin, training, so that should we get to a claim stage, we have really good claims defensibility to not only support your employees, but also to support yourselves and our customers in relation to defending claims if there are other causation sort of issues. So what are we doing here at Zurich? to support and protect our customers. So a big part of our proposition is very much centred around mental health and well-being. And just really looking at the slide here, I won't go through all of it because I'm conscious of time, but here at Zurich, we have dedicated qualified rehabilitation team. And as you'll see from the slide, they're a combination of mental health first aid qualified experts, but also nurses experienced in psychological vocational rehab and physical therapy. And by providing a comprehensive psychosocial triage, the main objective is to get that person back to the workplace as soon as possible for their own mental well-being. And also there is a cost to the business in obviously absence, which Dave has alluded to before. So as I said, work-related stress is part of our award-winning mental health wellbeing proposition, and I'm really proud to say that because we have in this year's Claims and Fraud Awards from Insurance Post, our mental health proposition team was a winner of the rehabilitation initiative, which for us makes us really proud because it shows that we are doing the right thing, internally and externally for our customers. The treatment that we offer ranges, predominantly between CBT and EMDR, which are sort of common methods, proven methods of really sort of understanding what that vulnerability is for each claimant and customer, and to understand what bespoke rehab program can we put together as part of that intervention strategy, which Dave referred to, which is so important to get people sort of back to their pre-incident state. And it certainly isn't that one size sort of fits all. And we also dovetail that program with any NHS provision. So we are working alongside other public sectors. So it's, the claimant is getting the best of both worlds. One of the recent initiatives that we launched as part of our claims proposition last year is what we call our Zurich Support Services mental health wellbeing. And basically what it is, we provide, at the time of a claim, we provide free counselling sessions to our customers and their immediate family as long as they're over 18. And we've found through previous research and since we've launched that this has been really critical to helping not just the individual, our policyholders, mental well-being, but also their family, because we appreciate that such insurable events like surge events, all the weather, climate risks that we're facing, it has a detrimental impact on the wider family, whether it's through the business protection, whether it's through your own home protection. And so basically, we thought within Zurich, this would be a fantastic offering that wasn't really being offered in the marketplace. And like I say, we launched that in 2021. And again, extremely proud to say that, we've received industry recognition, both in the 2021 Claims Excellence Awards and also the Insurance Post Claims Fraud Awards in 2021, where this initiative was a winner on both occasions for Customer Care Award and also Mental Wellbeing. So that's a very sort of high level overview of how our Zurich rehabilitation team is here to support our customers. And obviously after this webinar, should you require any further questions or support, then please reach out to myself or Dave, and we can certainly provide you more information where appropriate. So just getting into, well, okay, if that's sort of why we do it and what we do, I thought it'd be useful just to explain, well, how does this actually work in practice? So basically, we have a dedicated case manager that is assigned to support the impacted employee through the whole case cycle. And that includes offering advice and guidance where needed and monitoring the claimant's progress through that treatment, including psychometric measurements. The rehabilitation case manager is also not only there to support the employee, but also to the insured customer to provide timely updates and progress and advice on when the expected return of work is expected, and also to engage in any occupational health to accelerate that return. So what are the results of this? So by providing this proactive sort of intervention treatment and helping our employees back to work quicker than anticipated, without access to this service, Zurich's rehab team has saved our customers over 190,000 lost working days, which, as Dave mentioned earlier, is a significant amount of money and has a massive financial impact, obviously, on our customers. And one of our customers who actively uses the service has saved over 10,500 working days, which is equivalent to over 2,100 working weeks, which again, if you extrapolate that up, is a massive financial impact to the business. But more importantly, it's also protecting our customers' employee and their workforce. So just to round off, I thought it'd be useful to give you guys a bit of a case study as to the varied items of claims of intervention, and not all of these relate to the claim. So one of the case studies which I thought would be quite pertinent is the injured party on this occasion witnessed the fatality of his patient. So he's obviously a GP. That person was unable to return to work, had symptoms of trauma, grief and depression, and basically didn't want to return to work with complex patients or those on ventilators, as this related to the patient's passing, which obviously is where the trauma originated from. So we provided some EMDR sessions for this customer at the cost of just over £2,000. And basically the outcome was that at the initial psychometric assessment, which was assessed as moderate to severe, once we reached discharge, which was over a period of 6 months, the injured party had said this has helped massively, and that basically that person felt sufficient to get back to work to what he was doing before, and he was able to return to work without any continuing medical impairment or challenges. And again, from a customer wellbeing perspective, those are the case studies which are really, motivate and support why we have this team and why this is a really important part of our proposition. So, hopefully that's given you a very whistle-stop tour as to how we work with different areas of Zurich from a risk management prevention perspective, but also how we can support our customers at that time of claim to help get those customers and employees back to work and to be mentally fit and healthy, which is obviously what our main objective is. So, hopefully that's been of help. Again, if you have any questions, please feel free to ask those either on the chat or we can pick those up offline. Thank you very much.
Fantastic. Thanks, Jason. So very quickly, I'm just going to run through a little bit around the future, the evidence for trends and emerging risks. I'm conscious of time, so this is perhaps a story that you'll be able to pick up from when you get copies of the slides. But the idea of this was to sort of tell a story, and the evidence is pretty overwhelming from the prevalence of mental health issues in the workplace, people reporting working with a disability in June 2021. Through the upturn in depression and anxiety and the downturn in people's perception of their own well-being. But people are starting to do things about it. Organisations are taking action to reduce job demands and work pressures, or some organisations are, about half. But obviously it means about half are not. And we can start to sort of think about, well, referring back to what I said about the changing workplace with that last bit there, reasons for adopting home working as a permanent business model in April of this year. Other changes we're starting to see: increase in the use of technology, both by workers and to replace workers, increasing age of workers, average age, increasingly customer-facing work, and different expectations by young workers of their employers. We've got a few predicted changes in the claims landscape. So this is really just a bit of food for thought. I mentioned the case of Bailey versus Devon Partnership Trust. Since the health and safety landscape has changed in terms of how much stress is put on adequate risk assessments and comprehensive guidance in terms of stress at work, the HSE guidance, CIPD guidance, WHO guidance. The duty to assess risk could now arise at a much lower threshold than was set out in Hutton nearly 20 years ago. And such an assessment might well put an employer on clear notice of the need to take adequate steps to prevent an employee from injury, or in this case, ill health. Employers cannot sit back and do nothing about workplace stress. The SAFE system has to be, to a degree, proactive now. And employers will need to move with the times. One of the changes Bailey signalled was a move towards the expectation employers will be proactive, including contexts of occupations which pose a high risk of psychiatric injury. We have to think what support and intervention might be required. Employers must put increased support and people management practice in place for individuals in high risk roles. And we like to think that now what we've done with Zurich's proposition is to try and cover all of the key aspects of the management of psychosocial risk. And I'll now just quickly provide an outline of our proposition for you. So we've built this, or I presented this on the slide, so it maps across to how I explained the psychosocial risk management process under the ISO standard. So it requires a holistic and integrated approach. So that's what we've done with our proposition. We built in the risk management capabilities of Zurich Resilience Solutions and the resilience and rehab capabilities of our insurance business units, both across commercial and corporate risk, plus the use of carefully selected partners. This approach has the added advantage, as Jason mentioned, that customers can get the best value out of the services they are already provided free of charge as part of their insurance packages on the rehab side. So at the top, with the strategy, policy and management system, that's what ZRS can do, myself and my colleagues. We have offerings that are face-to-face, remote and self-service. Most detailed one is the health check. Benefits of that approach: you receive an independent opinion about the effectiveness of your strategy, policy and practices in delivering a psychologically safe workplace. The health check indicators that we use align with the clauses within the ISO standard. We help provide support for prioritising improvements and enhancements to your strategy, and it helps build links between organisational business aims and you having a healthy and resilient workforce to deliver them. We're very excited to soon be bringing to the UK market our award-winning DEI proposition. At the moment, it's something that's been developed in the States. We have a multi-tiered approach that aligns with ISO's Global Diversity and Inclusion Standard to help assist organisations with their change management process. As you will appreciate, risk assessment is one of the cornerstones for effective OHS management. It tends to be an area of weakness for many organisations with regard to managing psychosocial risk and mental ill health. A recent study of 6,500 companies in Germany showed only 21% had a psychosocial risk assessment. The study recommended enhancing companies' utilisation of professional occupational safety and health experts in the area of psychosocial risks, and that would be beneficial for improving the situation. And to help our customers with this, we'll very soon be providing a digital platform that will enable our customers to make an assessment of the risks of psychosocial hazards, provide worker wellbeing check-ins and management information to support effective decision-making to improve mental health, wellbeing and the associated organisational benefits. Again, this is aligned to 45,003 for those organisations that are looking to compare themselves to international good practice standards. So keep an eye out for further information about these excellent new services, or get in touch with us or your usual Zurich contacts to find out more. We have traditional areas of service around primary risk controls, the reduction of risk, around health and safety, ergonomics, behavioural safety and occupational hygiene assessment, consultancy and training. Jason's just run through what that looks like for the secondary tier risk controls on the resilience side and the rehab offering on the tertiary risk controls. Just suffice to say here that on the employee benefits side, it looks quite similar. We've mentioned a number of calls about mental health in 2021-22, around 4,500. That was increased by around 30% from the year before. In terms of successful intervention, 38% of those people out of work at the start of therapy were back by the end of the therapy. We provide free online workshops for HR and people managers covering a range of related topics. There's access to virtual general practitioner and second medical opinion services, support from professional mental health nurses, and sort of self-help resources as well. So hopefully that's given you a little bit of insight about the subject, the importance of having psychologically safe and healthy workplaces, and how Zurich can support you to achieve this. We've got time for a few questions now, and I'll leave you with a slide containing our contact details and some links while we are addressing any of your questions. But thank you ever so much for your attention.
Brilliant.